Hi. Welcome for today's session. We are learning today neonatal resuscitation definition and need. Equipment. Neonatal resuscitation program. Resuscitation councils and guidelines. Stepwise approach for neonatal resuscitation. Practical hints. And summary. Neonatal resuscitation is a set of interventions used to assist the airway, breathing, and circulation of a newborn following birth. According to the World Health Organization, approximately 10% of newborns worldwide requires some form of resuscitation at birth. We need to learn neonatal resuscitation to prevent birth asphyxia. Birth asphyxia, also known as perinatal asphyxia, is a condition that occurs when a newborn baby's body is deprived of oxygen before, during, or immediately after birth. First 1 minute in very crucial for newborn. The need for neonatal resuscitation arises when a baby is unable to breathe effectively or maintain their own circulation after delivery, and it is essential to prevent serious complications and improve outcomes for the newborn. Here's a table outlining some of the common items that may be included in a neonatal resuscitation kit. Resuscitation bag and mask to provide positive pressure ventilation to the newborn. Endotracheal tubes and laryngoscope used to intubate the newborn's airway if necessary. Suction catheters and bulbs used for emergency access to the newborn's circulatory system. Pulse oximeter and stethoscope used to monitor the newborn's heart rate and oxygen saturation. Adhesive tape and scissors used to secure endotracheal tubes, umbilical catheters, and other equipment. Neonatal resuscitation program is a set of educational guidelines established by the American Academy of Pediatrics that outline the proper procedures for resuscitation of a newborn. American Heart Association, American Academy of Pediatrics, Indian Academy of Pediatrics and International Liaison Committee on Resuscitation publish the guidelines and prepare structure protocols for neonatal resuscitation. Here are a few of the guidelines for your information. The style and word choice for educational efficiency may differs for American Academy of Pediatrics, Indian Academy of Pediatrics and American Heart Association, but it does not conflict the published science guideline. Latest guideline is based on 8th edition of NRP given by APA. We will follow the American Heart Association guideline for this learning session. This will maintain the continuity while learning pediatric resuscitation and adult basic and advanced cardiac resuscitation in upcoming weeks. Three important questions determine the course of action. First is term gestation. Second, good muscle tone. Third is crying or breathing. If yes to all, then the neonate do not require resuscitation. Here you need to dry the baby. Give skin-to-skin contact. Cover with dry linen to maintain temperature. Perform ongoing observation like breathing, color, activity. If the answer is no, then it indicates immediate requirement of resuscitation. Following actions in sequence need to be performed, including stabilization, warmth, clear airway, drying, and stimulate within 30 seconds. After Initial steps in stabilization: check for breathing and heart rate. If no, for apnea or gasping and heart rate more than 100 per minute. Check for labored breathing or persistent cyanosis. If it present, position and clear the airway. Monitor SpO2 and supplement the oxygen. Oxygen supplement must be according to the targeted pre-ductal saturation after birth. Here is the chart to guide SpO2 percentage. If gasping or apnea noticed and if the heart rate remains less than 100 beats per minute, then initiate positive pressure ventilation. SpO2 monitoring by pulse oximeter must be continue. ECG monitoring help to capture heart rate throughout the process. Increase in heart rate is the most sensitive indicator of a successful response to each step practiced. Next, you need to determine the heart rate. If it is not below 100 beats per minute, initiate post-resuscitation care. Once the baby is stable, provide ongoing monitoring and appropriate interventions to maintain temperature, glucose levels, and electrolyte balance. If heart rate below 100 beats per minute, check chest movement and initiate ventilation corrective steps. This must be done after 30 seconds of ventilation. Mr. SOPA is the mnemonics for corrective steps. MRSOPA, as given below. M for mass adjustment, R for reposition airway, S for suction, O for open mouth, P for pressure increase, and A for alternate airway like ET tube or LMA. If heart rate are less than 60 beats per minute, then chest compression must be initiated along with positive pressure ventilation. Advance airway must be considered if not done already. Ratio of compression to ventilation is 3:1. That means 90 chest compression and 30 ventilation must be done within 1 minute. Depth of chest compression is 1/3 of anteroposterior diameter of chest. You can use 2-thumb encircling technique or 2-finger technique for chest compression. Place your finger at lower third of sternum for chest compression. Ventilation and compression sequence are chanted like breath, 1 and 2 and 3 and breath, where chest compression synchronizes for every numerical count and chest recoiling on every end. If heart rate remain less than 60 beats per minute after 1 minute chest compression and ventilation, consider medicinal intervention. Epinephrine is first drug of choice. Doses are attached for your information. Check for hypovolemic condition and pneumothorax if heart rate are persistently remain lower than 60. Now let's study some other practical aspects. Consider delayed cord clamping in all vigorous neonates with good tone. Delaying clamping and cutting of the umbilical cord improves blood transfusion from the placenta to neonate. Position neonate in the sniffing position. Put roll under the shoulders, shifts the head to neutral or slightly extended position. Please refer the image attached. The 3-lead ECG helps to measuring the heart rate of the neonate. Obtaining an accurate heart rate measurement is of utmost importance as it helps guide resuscitation and is the most sensitive indicator of adequate resuscitation, as a normal heart rate reflects adequate oxygenation and ventilation. Site for ECG electrodes are given in attached image. Always place an oxygenation saturation monitor probe on the neonate's right hand or wrist. It provides pre-ductal oxygen saturation reading. When to stop resuscitation is sensitive and situational. Always follow local protocol while taking any such decision. Let's summarize. Assess the need for resuscitation. Position the baby with the head slightly extended and clear the airway. Dry the baby and stimulate breathing. If the baby is not breathing or gasping, provide positive pressure ventilation, PPV, with room air. Assess the heart rate within the first minute of life using a stethoscope or pulse oximeter. PPV and oxygenation. Provide PPV if the heart rate is less than 100 bpm or if the baby is not breathing effectively. Use an appropriately sized mask to provide PPV with room air or blended oxygen to achieve target saturations. If the baby does not respond to PPV with a mask, consider advanced airway management such as intubation or a supraglottic airway device. If the heart rate is less than 60 bpm despite adequate ventilation, start chest compressions along with PPV. Give 3 compressions followed by 1 ventilation in a cycle of. If the heart rate remains less than 60 bpm despite effective ventilation and chest compressions, administer epinephrine. Once the baby is stable, provide ongoing monitoring and appropriate interventions to maintain temperature, glucose levels, and electrolyte balance. That's it for today. Thank you for watching. Please like the video and subscribe the channel for upcoming educational videos. Share the link for saving many more lives.